Hi everyone. So I really hope your first couple of weeks here are getting started well in NURSU 428, and the next step in the process, hopefully you have begun, you've submitted your PICO question, you've begun to define the problem. So let's backtrack and make sure we understand where we are. So in Dr. Anderson's class, you did a PICO question, you did a brief literature search. Some of you are using that, some of you are maybe doing something different now, but still the process is the same. You identify a potential problem and you research the literature to sort of see what's going on and what are the best practices, what's the best evidence available. So now that you've started this course where we want you to, the clinical hours you spend are to begin to develop an evidence-based practice quality improvement project proposal. To do a thorough, develop a thorough proposal, you need to identify all aspects of the problem, of what's going on, how you, what the literature says is the best evidence, how you plan to try to resolve the problem, what is the implementation, the intervention that you plan to use to try to resolve the problem. So hopefully everybody is on board with what we're doing here. The whole idea is we're teaching you how to conduct continuous quality improvement based on the best evidence available. See? So that's why it's important to know how to search the literature. It's why it's important to know what is the best evidence available, because what we really don't want you to do is to just come up with something in your mind. Oh, I think this is a good idea. Let's try this. That, unfortunately, was a good bit of the history of nursing has been based on people's good ideas, thoughts, ideas, something we think will work, and yet no data to support it, no evidence to support it. So now as we talk about the second step, so define. So remember in the QI roadmap, if you really pay attention to that, it's DMAIC. So define is the first step. You're defining the problem. You have a PICO question and you're defining the problem that you want to work on. So the next step, measure. The M is for measure, and measurement is so important because measurement represents data. Everything that we want to do should be based on data. So there was an old crazy saying, and I can't tell you who it should be attributed to, but it says, in God we trust, all others must bring data. My thought is that's probably from a statistician. So statisticians love data. Researchers love data. I have a PhD in nursing. I love data. What we want all nurses to begin to understand is how important it is to understand data, measurement, and what does that data tell us. Okay, so you know, we all have ideas. I've been a nurse for 33 years. I always had in the past, ideas about, I think this is wrong, we should do this better, I don't know why we're doing this way. But until I really got into my doctoral program, until I began to understand the processes involved in measurement, in data collection, in understanding what the data shows and represents, I didn't have a clue. Most nurses don't really have a clue about this. So because you're in a BSN program and we want you to graduate with your BSN and we want you to step up another step beyond what you gained through your ADN program, it's about leadership and it's about understanding quality improvement, evidence-based practice, patient safety. How do you lead the way in doing those things? So now all that being said, for this summer, for this project proposal, we want to keep it very simple. Some of you may have some background in research or may understand or know what researchers do. We don't want you to do a bunch of research and gather a bunch of data like researchers do. We don't care. I shouldn't say we don't care. We don't want you to worry about statistical significance as much as clinical significance. Clinical significance is important. But the point is you have to have a plan for your project proposal of what kind of data will you gather, how will you gather it. We'll talk about that in a minute, but that's what we're talking about here in measurement. Measure. So once you've defined a problem and you have an idea of how you think you want to maybe make it better, what you have to be able to do in this process is to tell us how bad is the problem. That's a key question. How bad is the problem? And the only way to know how bad is the problem is to have data, to have something that helps us understand why this problem is, not why it exists. We'll get to that and analyze, but why you believe this is a problem, and that's based on some numbers, some data that you may have. So for the majority, almost should be all of your project proposals in this course, we want you to use what's called descriptive statistics. Some of you may know what that term means. Many of you may have no clue what we mean by descriptive statistics, but descriptive statistics basically are averages. Averages we also talk about in the research world as mean, the mean. So when you hear that term mean, the mean is an average of numbers. You can go into a little more detail about descriptive statistics that there's median, there's mode, but right now we're really probably going to just focus on the averages or ranges, perhaps low to high type ranges. Maybe we're talking about time frames. That's fine. And that probably would be some type of a range, or maybe we're talking about percentages. And so often when we do data collection, we're looking at percentages. For example, for infection rates, we're often looking at statistics that represent some percentage of a larger number. So we don't need to get into a lot of specifics here, and you don't have to, fortunately, have a statistics course here. You don't have to understand the full detail, but what you do have to do is to be able to describe what kind of data are you thinking about gathering. We hope you do this in your team meetings. You don't have to think about this by yourself. That's the whole purpose, that we want you to be a team leader, have some other people involved in this, because there are other people who may be able to help you understand and think about what data should we gather, how can we gather that, where can we get that data. Those are all important points, and I'll get to those factors in just a minute, but the whole idea is that it's all about measurement is all about, we have to start obviously from the beginning. You want to know what is the current situation, what's the current measurement of what we're looking at, because then what you do is that you will propose an intervention that you hope improves on that same measurement. So this is really the key, and I just really want to take a minute to explain the difference between researchers. When researchers develop a research proposal, they are exploring. They are trying to gain new meaning. They're trying to develop new knowledge to something that we, human beings, all of us, don't know enough about. We don't want you doing research. We don't want you venturing down the paths of, we don't know enough about this, so we want to find out more. Sometimes what that entails, and this is really an important point, is we don't want you comparing one intervention to another. How does this intervention compared to a different intervention affect some measurement? We want you to have one intervention that's a new evidence-based practice that may not be being implemented in your area, and you want to base that on what's the current measurement, what's the current data show how we're doing, and if we implement this one thing, let's see if we make an improvement in that same set of data. So I hope that makes sense. I'm trying to make this as clear as possible and in a very brief time frame for you. So the whole key in quality improvement projects, and that includes all of the, for MUSC Hospital, the RN3 projects are based on the IMPROVE process. We're using DMAIC, they use IMPR OVE IMPROVE, but nevertheless it's virtually the same process. That quality improvement involves knowing what's currently happening, having measures to demonstrate where are we right now, and then we want to implement something that will improve those measures and we're going to measure the same things. So that's, measuring apples to apples, the old saying. We don't want to measure apples to oranges. We don't want to have one set of data before we implement something and then a different set of data. You have to be able to figure out what is the measurement, and that's the key to this measure piece. What is the measurement that will be best demonstrated, that will hopefully show whether we've made a difference or not in our planned improvement process, our implementation of something that hasn't been done or isn't being done correctly or isn't part of what we're currently doing. So hopefully that makes sense. So there are many tools for measurement, and I just want to touch base on that briefly. So you don't have to typically invent something. You may, but you don't always have to. There are all types of data being collected all over every organization all the time. It may be that the problem you're trying to resolve has plenty of data already being collected. That's great. So that may be in the form of audits, which are often related to compliance. That may be in the form of benchmarks, standards of care, standard operating procedure, and we're trying to see how we do compared to that. Maybe it's about the benchmarks that are something around the INDI-NQI. So that's the nursing data quality in nursing data. National Data Nursing Quality Indicators. INDI-NQI, National Data of Nursing Quality Indicators, and that's a big deal too. So there are a lot of things that every organization is already collecting data on. It's very important to understand what kind of data is already available to you, and we'll talk a little bit more about data here in just a minute. So those are some of the things that go into this whole idea of measurement. And think about this. Pay attention to that final poster, to that final paper example. That's what we want you to be able to put in here. Is you have a way to define what's the problem you're trying to address, and what's the current situation. Maybe that's a process map, maybe that was a fishbone diagram, but some way, here's what the current process, here's what's currently happening. And then the next step, the measurement is, and here's the data to show that this is a problem and how bad the problem is. That's the key, see? We want to be able to say that we don't just sort of think this is a problem and we're thinking about something just for the heck of it, but we want to really be able to show what is the problem and how bad is it based on numbers, based on some data, and then here will be our plan to improve that. So it's important to measure the baseline, what's currently happening, not what should be happening, not what a policy or procedure says, but what's the current process and how is it currently working. And that's where that process map that you'll find in the Practicum Toolkit, that's where that's so vital to understand how to use that, and how that can be beneficial to show you that so often we, all of us, and especially management and leadership people, base what we think is happening on the policy. Well, it's supposed to happen like this. This first, this second, this third. But guess what? There are a lot of things that are not happening the way they are supposed to happen. They're not happening the way the policy reads or says. So when you're doing a quality improvement project, or potentially, or especially when you are proposing a quality improvement project, you want to be able to identify what's currently happening, not what the policy says or how we think it should be happening. So that's very key. The next key to this whole idea of measurement is just to keep it simple. We are not looking for these grandiose statistics. We want you to be able to identify things that are just some basic numbers that, again, are likely being collected. But if they're not, all of the faculty, myself and our other faculty in this course, can help you say, okay, well, the thing I'm thinking about, we really are not collecting data currently on it. Okay, let's think about how you would propose to begin to collect some pre-intervention data, some data that you would gather before you even intervene, if that data is not being gathered. Then we'll propose that you have the intervention. Then we'll propose that you gather the same data after your intervention. So that's sort of the process. And we just want to point out a couple of things that are really vital for you to understand in terms of data. And statisticians and researchers, lots of people will talk about all kinds of data. We just want you to understand two basic concepts. One is primary data, the second is secondary data. So primary data is data that you gather, that you collect in some way, where it may be through observations, things you count, things that are timed, checklists, something that you implement and you gather yourself. That's called primary data. In a very simplistic way, what I'm saying is, if you're gathering data that you are using a tool to gather that data yourself, that's called primary data. Secondary data is data that someone else collects and you're looking at. So there are plenty of examples of secondary data, infection rates, fall rates. There's all kinds of things that hospitals collect around all kinds of data, patient satisfaction surveys, things that are already collected. All that is secondary data. So if within your project you think about proposing a survey, maybe it's a survey of staff, maybe it's a survey of patients, survey of family members. If you're proposing some type of survey, that's okay, that's fine. And if it's something that has not been done, then that would become primary data, something that you are going to implement and gather data on. That's okay, that's primary. That's not the same thing as patient satisfaction surveys that are already being gathered. The data is already being collected. That would be secondary data. But let's say you're proposing to gather some survey data on staff, on their thoughts, ideas, opinions, knowledge about something. All right. There's something very important to talk about in terms of using a survey. Number one, the first and most important thing is everything should always be anonymous. We're working on quality improvement projects here. If you began to gather names and dates of when they filled this out and all kinds of background information on people, now you're into a research project where you need IRB approval. We don't want that to be the case. Surveys should always be anonymous. All the data is de-identified, no personal identifiers whatsoever. Secondly, we don't want you to propose something where you're creating your own survey. This is really an important point, that there's a whole process about how surveys have to be validated, how they have to be determined to be reliable. Number one, is the survey, are the questions asking the questions that we believe will give us the answers that will lead to the results we seek? It's complicated, but the idea is sometimes you develop survey questions and they don't really give you the answers that you're really trying to find. Hope that makes sense. But don't even worry about that. The idea is surveys should be valid and they should be reliable. If I do this over and over with different groups of people, I should get virtually the same types of results. I shouldn't have drastically different results from one group to the next group. So there are some really key points about reliable and valid surveys that we don't want you to be developing your own. Oh, I'm just going to develop a 5-question survey. Well, you don't have a clue if that's reliable or valid. So it's really important then in survey use to find surveys that have been validated, that have been shown to be reliable. So that's really an important point. And you can find plenty of surveys that have been done in the literature, and you will look for where does the author say that this survey has been validated, it is reliable based on statistics. So that's really an important point that I really want to make about surveys, all right? So we talked about secondary data, often coming from the health record, the EHR, EMR, data that's already been collected. So secondary data is always wonderful. Anything that you can do in your projects where you know that the data is already being collected and you can just have access to that data, that's awesome, right? And most of the data is what we call sampling data. So we really want you to use data that's reliable and valid as well. And sampling has, for researchers, there are specific ways that you develop what's called a power analysis. How many samples do we need for this to have this to be reliable and valid? So you don't have to worry about all that. We just want you to know that in terms of data collection, we typically, let me back up a bit. When you develop a quality improvement project, you want it to be done for all patients, all subjects that you are working toward. The data you have may not represent every subject, every patient in that group, but the sampling hopefully is done well enough in the secondary data collection that gives you a good representative example. So I don't want that to get too complicated for you. I just want you to understand that you have to be able to explain in your paper and final poster the measurement process, the data collection process. You can use your team members to help you develop this. That's the whole purpose of us wanting you to develop a team of people, several other people, hopefully not just a couple of other nurses or a patient care tech, but a practitioner, maybe a physician, a quality improvement person, a risk management person, infection control, somebody who can help you decide what kind of data should you propose to be collected. All right, I hope that helps. I'm trying to make this as clear and simple as I can, and just let your faculty member know if this is not clear in some way or you have questions. Thanks very much.